All right. Let's see how this goes. This is actually our first official live stream, so I'll be working out some bugs too, potentially. One of the biggest things is if the audio goes away, let me know. We still haven't figured out why sometimes that kicks out. So this should be pretty chill. Just be going over some of these questions and stuff that if you didn't get already, you can get them by clicking on the link in the description. That'll send you to get this one and the next 3 presentations over military press, lat pull-ups or lat pull-downs, but a pull-up really, and push-up mixed in here with the squat. And one of the main reasons I'm doing this is because whether you're a starting out student, experienced clinician, educator, I think a lot of times we're not speaking the same language, and biomechanics is the language at which we speak as therapists. So it's very important that we have some understanding of some basic foundational concepts. So I think this hopefully can get us started in the right direction to improving that literacy. And if you've already looked at these questions, you'd see they can be a little challenging, especially as true-false. And the number 1 commandment for taking a test is read everything correctly. There was someone I work with who would tell people, well, you got to read things, you got to read everything. Like, no. You got to read everything correctly. That's what you got to do. Honestly, this is the number 1 reason people miss questions on an exam. Maybe the top reason is because they don't know the information, but even if you know all the information, if you read it incorrectly, you're probably going to get it wrong. So read everything correctly. It's super hard. The answers could be found probably in the Essentials of Kinesiology, but there is no one chapter that's going to have answers to all this stuff. You're going to see questions towards the end here that have up to... Hey, Gallo. You're going to see things here that have up to 4 levels of thought. And you're not going to find any chapter that puts all of that together into one thing. So that's what makes these so challenging. Main objectives for today: challenging your understanding of, can you read a test question correctly? Okay, or can you at least read these correctly? Also, can you envision what is happening? A lot of students, they'll read the question back to me and they'll read it perfect, and then I'll have them demonstrate what the question is saying, and it's not even the same thing. Instead of a squat, they show me a bicep curl, for example. It's not that extreme, but they're not envisioning it correctly. So we got to make sure we can envision things correctly. I had a student this past week on the midterm who missed a bunch of questions because they were envisioning. They read it. They kind of read it correctly, but they envisioned the wrong exercise. So they missed a ton of questions, even though they knew the right answers had they envisioned it correctly. We'll look at those arthrokinematics, osteokinematics. You'll have some concentric, eccentric concepts, and open and closed chain. So all of those things are going to be put together in some of these questions. So I'll give you guys some time to kind of look at this question for those of you who may not have had a chance to look at the questions yet. So take a little gander at this guy. I'll get that video moving for you too. So the patient is performing squats. Obviously, that's what the patient's going to be performing in all of these videos. As the patient moves towards the earth, the iliacus and psoas major are contracting to control hip flexion. True or false? So, if you think it's true, then that's all you got to do. This is why I like true-false questions. The burden of proof is on the person who thinks it's false. So, if you think it's false, why is it false? Well, the answer is false. That's for sure. So what makes this false? Well, a couple things. So as you're reading these types of questions, you should be able to analyze, okay, they're doing a squat. Can you envision what's happening? And then as the patient moves towards the earth, anytime you see this towards the earth, you should be thinking first off, oops, eccentric contractions. Okay, whoops, I don't know, my picture's covering that. Eccentric. If our resistance is gravity. So for all these questions, our resistance is going to be gravity. So earth, eccentric. If you're moving towards the earth, eccentric. So if you see any contractions in here that are not eccentric, it's going to be false. So the patient is moving towards the earth. All right, so we better be expecting eccentric. The iliacus and psoas major are contracting to control hip flexion. Okay, well, when you watch the video, you'll see as I move towards the earth, the hip is flexing. So that's true. And there's no mention of a specific type of contraction. So the final thing we need to see if it's true is the iliacus and psoas major involved in a squat? And the answer is no. This is one of the weaknesses of just memorizing flashcards, for example, is the flashcard will tell you the iliacus and psoas major flex the hip. But what is causing hip flexion as I move towards the ground in this video? That's going to be eccentric glute max. The hip flexors, for all intents and purposes, during a normal squat for test questions, are not involved in a squat. So that's what makes it false. Iliacus and psoas major. Yeah, Penny. That's what I'm talking about. All right. And if you have any questions, obviously put them in the chat and I'll try to get to them here. We're going to head on to the next question. Again, I'll give you some time to read it. Sergio, I just realized that was you, dude. That's awesome. Hey, congrats on the engagement. I didn't get to watch the entire video because it's like 6 minutes long. But this guy, he did like the most incredible like engagement. What is it? You know how like people do like the reveals for their their kids' sex or all these other crazy things. But Sergio did like an incredible engagement to his soon-to-be wife. So congrats, man. That was pretty awesome. But I haven't finished the video. It was like six or 7 minutes. Eileen was showing me in school. I was like, I don't know how I'm supposed to like watch this for 7 minutes right now. I'm teaching class. Gene, I'm so glad I could help you out on that. Yes, I'm excited. I love these types of questions because it shows you so many things about your ability to analyze a test. Because I'm sure people can tell me what open and closed, concentric, eccentric, all these things, but do they know why? And are they getting these questions correct because they can analyze the question? This is, I think, a great exercise in that. All right, here we go. We've had plenty of time for this. The patient is performing squats as she moves towards the earth. So remember, we have earth. Here's our key term. First one that pops up should be eccentric. The hamstrings are controlling motion at the knee as it flexes. So when I'm going towards the earth, is my knee flexing? 100% it's flexing. However, are the hamstrings flexing the knee? No, the hamstrings are not involved in a squat at the knee. They can be involved in a squat, but not at the knee. The knee is flexing because of the eccentric contraction of the quadriceps. That's why. All right, next question. So, well, before we move on to that, there should be a quick summary here. Both of these have been false because they've had the wrong muscle, right? So we should know now the iliacus, the psoas major, and the hamstrings. The iliacus and psoas major at the hip and the hamstrings at the knee are not involved. So now we know from here on out, if those muscles are involved in those motions in a squat, incorrect, because those muscles at those joints are not involved in a squat. So it automatically makes it false. So we have a nice tool in our belt here. All right, next question. Yes, Jesse, the hamstrings they will act like the glute max at the hip. So it has to be the proximal hamstrings. Get that video playing here. So as she moves away from the earth, so now we have a different movement away from the earth. And because gravity is our only resistance in these examples, if it's away from the earth, you're going towards the sky or towards the constellations. See, concentric. Away from the earth, constellations, concentric. So any muscle contractions that are occurring in this question better say concentric. So as she moves away from the earth, okay, concentric is what it needs to be. The glute max is contracting concentrically. Okay, well, we've established the glute max is involved in a squat, so that's true. We're moving away from the earth concentrically. All right, I'm loving what I'm seeing here. This could be true. To extend the hip. So here I am at the bottom. Now at the top, I'm extended as I move away from the earth. That then, true. No burden of proof on anybody. I mean, I kind of just proved it there, but we all should be saying true on that one. All right. To the next one. So as you're reading this question, you should be doing what I'm doing as I go over it and making sure everything matches that's true. A lot of times people look at these questions and they see all the words and they get overwhelmed. Just take it one piece at a time, finding true statements as you go through, because as soon as you find a false statement, it's false. That's what I love about true false, way more than multiple choice. I always think it's funny that people are like, oh, I hate true false. I'm like, dude, true false already gives you only 2 answers versus 4. You already have a better percentage chance. And as opposed to oftentimes picking a best, most, or worst type situation with a multiple choice exam, if it's just true false, all you got to do is find one false statement, one false thing, and it's false. That's it. So let's see here. As she moves away from the earth, again, away from the earth, this better be a concentric contraction. The rectus femoris, which is a quad muscle, okay, so move away from the earth, concentric, rectus femoris, the quads, all right, the quads would probably involved in a squat here. Let's make sure the joint matches. Is contracting eccentrically to extend the knee. Okay, wait a minute. The quads extend the knee, moving away from the earth. So let's watch the video again. So I'll be coming down, and then as I move away from the earth, I start in flexion, and then I'm going to finish an extension. So that's true. But the answer is false because the rectus femoris is not contracting eccentrically. I'm saying it's false, burden proof on me. I'll change it. Contracting concentrically because you're moving away from the earth, constellations, concentric. That's why it's false. Next question. What's up, Mallow? Hey, Gina, that's awesome. These types of questions are just fun because they're so silly. Honestly, they're obnoxious because there's so much into reading the question. That's why so many students are like really smart and they know these concepts individually, but putting them together and then adding in the weird, crazy verbiage of the question is like, ugh, it's crazy, but it's the nature of the beast. Okay, here we go. The patient is for performing squats. All right, damage to the side. Oh, no, he's bringing nerves in. When someone brings nerves into a question, it's kind of a way to like not give you the muscle. So it's an extra step. So you're like, okay, sciatic. So we're here. Damage to the sciatic nerve. All right, so first thing you should kind of start thinking about is what would be innervated by the sciatic nerve? Well, hopefully we're going to say hamstrings. And you know what's awesome? Because we've been going through this already, there's a good chance it's going to be false. I have false on my radar, okay? Because we said the hamstrings are not involved at the knee. So, damage to the sciatic nerve will affect knee flexion. Oh, it's not involved in the knee at all. As the patient moves towards the earth. Well, there's some tricks here. Whoops. As I'm moving towards the earth, my knee is flexing. So that is true. However, the hamstrings are not controlling that motion. Thus, it's false. Another question, we got it. We found its trick. We're not going to let it get us. And a lot of this is about... yeah, they're silly. They're so silly. A lot of these... I don't even remember. Oh, I don't know what I was going to say. I got wrapped up in the chat. All right. All right, we got our last two here. Last two. I love this because you add in the arthrokinematics. Take a little look at this guy. So this question has a lot of information to try to get you to envision what's happening. That's why you could read the words correctly. Oh, you read them all right. But rule number 2, can you envision it? So hard with something like this. So let's work on it. When the quads are concentrically contracting, so if we see that concentrically contracting, whoops, let's get the highlighter out here, or the PowerPoint, or the laser pointer here. When the quads are concentrically contracting, okay, quads are involved in a squat. Concentric means the knee needs to be extending, because concentric means they're moving away from the earth. So that means you're going to be extending that knee. So when the quads are concentrically contracting or extending, the femur is rolling posterior and gliding inferior on the tibia. Okay, here we go. We got those arthrokinematics now. So what it's asking, it's telling you, it's giving you clues by telling you what's happening here. So quadricentric, so we have closed chain, it's closed chain, knee extension. Whoops. That corner never wants to write. So we have closed chain knee extension. So let's look at some of our arthrokinematic concepts here. If it's closed chain knee extension, it's true. The femur is the bone that's moving. Okay, it is the bone that's moving. The proximal bone moves when it's a closed chain activity. So when the femur contracting, the femur is rolling posterior. Now, when you are doing closed chain extension, the femur is rolling anterior. It's going to roll anterior. So this is going to be false. The femur would roll anterior. This is false. And it would glide, not inferior, but it would actually glide posterior. So closed chain knee extension is always going to be an anterior roll and a posterior glide based off our rule of arthrokinematics. I got a little YouTube video on that. Sometime I can go a little more deeper if you want to. So if you just got ripped apart because of arthrokinematics, guess what? This is what's awesome about this. That's what you need to study. You don't have to study a bunch of other stuff when you're missing these questions. You missed it. If you missed it because of arthrokinematics, you got to study some arthros. I used arthrokinematics in this question to show you the motion. And, I used the contraction to show you the motion, and you had to figure out the arthrokinematics. So it's multiple layers. Yep. If it's convex on concave, the roll and glide are opposite. All right. I believe this is our... No, we got one more after this. I made another one. The patient is performing squats. Here we go. We got one more after this. Actually, it looks like I put a repeat question. So this is the finale. This is the finale. Let's see. Can you get it? Can you get it? All right, here we go. The quads are eccentrically contracting. So if the quads are eccentric, that means we better be having knee flexion occurring. So, whoops, it's the ugliest K. Knee flexion is the motion that's occurring because the eccentric contraction of the quads. It's going to cause me to see in this video, eccentric, quads are working at the knee, I am flexing. So when the quads are eccentrically contracting, the talus, oh no, down at the ankle, the talus, and if you didn't know that, guess what? You need to study joints. No big deal. The talus is rolling posterior and gliding inferior on the tibia. All right, so I don't have a zoom in on my ankle here, but when the knees are flexing, we're going down, so we need to think about what motion's occurring at the ankle. So when I'm going down, the motion that's occurring at the ankle is a slight bit of dorsiflexion. You can see that tibia is a little anterior there, so we have dorsiflexions occurring at the ankle. Now, this is closed chain, so closed chain dorsiflexion, what bone's moving? The proximal bone. The proximal bone is the tibia. Now, is the tibia convex or concave? And the answer is concave, moving on the convex talus. So our rule now is the opposite of the one we just did. If the concave is moving on the convex, the roll and glide are the same. So the roll of the tibia and dorsiflexion is anterior, which means the glide has to also be anterior. So let's see, do we have that right up here? The talus is rolling posterior. Well, the talus isn't even rolling to begin with, so automatically false. That should have been the tibia, not the talus. The talus would be moving in an open chain activity. Nice, Christy. I hope you got it right. Did you get it right, Christy? So see, I used the different, made you think about some different joints there. So that is the last question. So now what? So if you want to share your score in the chat, that's awesome. I don't think there's anything wrong with that. Be humbled. I did. You did. This is great. Exactly. That's the key, Gina, is that you know what you need to study. I think it just sucks because I think a lot of times students don't know what to study and they're just overwhelmed. I use the example of telling my students, if you try to catch a waterfall with your hands, you don't get any water. It's funny. You try to catch a raindrop, and you do get some water in your hands. So when you try to get it all, it's just too much, and you get nothing. So you have to, when you study, figure out a specific thing you need to work on. And then that's what these questions will do. And that's the self-assessment. Self-assess. Now that I've either gotten 100, even if you got 100 doesn't mean you're perfect. Maybe you got lucky. You have to get it right for the right reasons. So self-assess, see where your weaknesses are, see what you need to work on. If you just feel super weak with action, origin, and insertion, I have my muscle anatomy study strategy that you can learn more about in the description of in this video. And I want to talk to you about the next live session. This was fun. It was a blast. It's super cool to go over these test questions. I'd like to go over the military press March 12th, which is next Saturday. But the time, I don't know specifically because Megan and I are donating blood at 8 o'clock Mountain Time. And then we will pick up some awesome food since we're going to lose like 650 calories on that. And then I'll go live. So it'll probably be closer to 11 when I cover the military press. And that's the plan for next week. And if you have any comments, things you enjoyed about this, things you're like, hey, man, this could be better next time or whatever, let me know because I will 100% take your ideas into consideration. Hey, Andy. Exactly. Get rid of that lateral flexion. Where's Mallow? I don't know. Maybe she's doing our taxes. That'd be great. Folding the laundry. If she would just fold laundry, that'd be great. Mallow's our cat, by the way. She's not going to fold laundry or do our taxes. Megan, can you find Mallow? Uh-oh, here she comes. This is the boss lady right here. Jeez. Yeah, everybody heard you screaming.
Here she is.
Everything we do is for her. We go to work, everything, to make sure the heat's on and she's got food. It's crazy. Right? Oh, I love pets. Hey, Gina, you totally recruit more people. That's awesome. Let's get them in here. And people think they know everything. If you know clinicians, hey, this is fun. It's easy. Let's see what the clinicians know, because honestly, the clinicians can be the worst sometimes. Well, after you've been out of school for a couple of years, you forget all of it. Yeah. So, bring everybody that you can. I don't care. It's fun. I enjoy this. So, like I said, I'll keep you posted on when we start next Saturday, but that military press for sure. And if you don't know what a military press is, I'll put a video. The PowerPoint's not fully updated. I need to videotape myself pressing weight up away from the earth. And like I said, I believe when you signed up for those, I challenge you to use every resource you can. Use them all and see if you can still get 100. Because I think it's pretty tough. Hey, in fact, did anyone get 100? You got it. My class needs this. Yeah, every class needs this. Totally agree. This is what I do with my students all the time. I'm just like, if we don't know the muscles, because we're not even treating yet. When we talk about treatment, if you don't know the muscles involved in an activity, how are you going to effectively treat? You're not. So we have to speak that language. All right, guys. Well, most important thing that happens, this is my team right here, Jesse and Megan. Jesse, right here, Megan. There we go. But we really, really appreciate you guys showing up. Tell your friends about it. Let's have a good time. And it was just fun. It was cool. So check out that military press. If you're like, what's he talking about? Where do I get these questions? Remember, all the questions, a link to my folder that has the PowerPoints that are literally this right here. They're going to be there for you. So, and if one of your friends thinks they don't need this, well, ask them some of the questions on the PowerPoint we just did today. And if they miss it, well, there you go. There's the proof. All right. Hey, y'all have a great rest of your weekend. We're going to enjoy ours. Peace out.